Bismillahirrahmanirrahim. Welcome to Medical Globe e-learning. This is Mustalim from Shaida Islam Medical College. So now today's our topic is joints of lower limb. First of all, seat stores. Here are 7 MCQ and 2 SCQ from lower limb. Now first of all, our important UQ is hip joint. You have to know its articular surfaces. This one and next all this one, and you have to know about joint capsule of hip joint and their ligaments involved in the attachment of ligament. All are important in hip joint, and these diagrams are important to see the ligaments of hip joint. Now we move on to the movement of hip joint. This paragraph is important for the hip joint, and these green underlines are important to see the muscles involved in hip joint movement. Now blood supply of hip joint, these green underlines. Nerve supply, this one and this one. Next we move on to the knee joint. It is also very important for UQ point of view. Same is the case, you have to know its articular surfaces. It's this one and its ligaments, blood supply, nerve supply, and you have to know about their movements. This one is the joint capsule, mean ligaments, extracapsular ligament. It is also important for SEQ point of view. You have to know the names of ligaments and their attachment. Next one is the intra-articular ligaments, that mean cruciate ligaments and menisci. You have to know about the difference between anterior and posterior cruciate ligament and lateral and middle menisci. It is important for SEQ point of view. All this one underline with green. Then blood supply of hip joint. It is by genicular anastomosis. This table is important to see the movement of the knee joint and the muscles involved in it. Then bursa around knee joint, it is also important for SEQ point of view. This one, here are some bursars. Then here is a tibiofibular joint. It is important for SEQ point of view. You have to know the articular surfaces, ligaments, blood supply, nerve supply, and movements. Next, this table shows the bursars of knee joint. It is very important for SEQ and MCQ point of view. Then blood supply movements. Tibiofibular syndesmosis is also important for CQ point of view. You have to know about their ligaments, this one, and nerve supply, blood supply. Next one is the ankle joint. It is very important for UQ point of view. Same is the case, you have to know the articular surfaces, this one. And here are some MCQ highlighted with yellow. You have to read it for conceptual point of view and for MCQ. Then here are the ligaments involved in the ankle joint, this one. Movement of ankle joint, this one highlighted with yellow. Then blood supply and nerve supply. Next one is the foot joint. Foot joint, it is not as such important for SEQ point of view. You have to know it for MCQ and conceptual point of view. All these highlighted with yellow are important points. Subtalar joint, it is important for SEQ point of view, and you have to know all the ligaments involved. This table is important to see the joints of foot. You have to know it for MCQ point of view. Then this table is also important to see the movements of joints of foot. Then here comes the major ligament of foot. It is very important for CQ point of view. All these ligaments you have to know it for CQ point of view. Then arches of foot. It is very important for UQ point of view. You have to know about the function of arches, their importance, and the difference between medial and lateral longitudinal arch and transverse arch, and the factors involved, this one. Our chapter is almost end. Next we move on to the clinical box. This one, fracture of femoral neck, it is important for CQ point of view. You have to read all these yellow paragraph. Then surgical hip replacement, it is also important for CQ and MCQ point of view. Dislocation of hip, here are some important highlighted points. You have to know these points. This one. And next is the genovalgum and genovalgum. It is important for clinical and SCQ point of view. All highlighted with yellow is important. Then patellofemoral syndrome. It is important for SCQ point of view and also for clinical purpose. Knee joint injuries, it is very important for UQ point of view. You have to know the fracture and tear of ligaments and bones. All this one. Then bursitis knee joint is also important for CQ point of view. Then popliteal cyst, it is also known as Baker's cyst. You have to know their medical clinical importance, and it is important for CQ point of view. Ankle injuries, it is very important for UQ, especially the port fracture. This one, it is important for UQ point of view. Tibial nerve entrapment, that is tarsal tunnel syndrome, it is also important for SCQ and MCQ point of view. Hallus valgus, hematochloto, all are important for clinical point of view and for CQ. Peaceableness, it is also important for CQ point of view. Clubfoot, it is very important for clinical point of view. Our chapter is end. Hope so you can understand. For better preparation of Prof, you can avail services from Medical Globe Book MBBS Cracks. Thank you. Allah Hafiz.
Medical Globe introduces its series of successful publications, MBBS Cracks, the benchmark of all, containing all the chapter-wise questions of prime importance, all annual and subtly solved university questions, questions to ace your vivas, chapter polls, and of course, we have incorporated all the labeled and histologic and anatomic models in high resolution for your distinction level OSCE preparations. Medical Globe has also launched a gem in the medical world to master every concept for your multiple choice questions, the MCQ cracks encompassing UHS, NAMS, and many others, revealing the UHS MCQ rank, your practice MCQs, and topic-wise MCQs. Get your MCQ and MBBS cracks at your doorstep by placing your order at 0335 66 33007.